most at risk of severe disease to come forward and take advantage of the vaccination program and now the increased availability of vaccines that we have. I would like to also urge those who've already received their first dose of AstraZeneca to ensure that they go ahead and get their second dose. We now have enough stocks within the country, and so there should be no hesitancy when it comes to coming to get your second dose of AstraZeneca. Finally, let me remind Kenyans that all vaccines which we are deploying are safe, they are equally effective, and that we should all come forward and get vaccinated with whichever vaccine is available. And it's important we emphasize this. No vaccine is superior compared to another. All the vaccines that we have in the country now, Moderna, AstraZeneca, and Johnson & Johnson, have the ability to prevent you from ending up in an ICU bed. So come forward and receive your vaccine. I would like to take this opportunity to thank all the partners who've made this possible. I'd like to thank Africa CDC, the AVAT team, for making this possible, as well as our partners, WHO, UNICEF, UNECA, Johnson & Johnson, who continue to work with us as we fight the COVID-19 pandemic. I'd also like to extend our appreciation to our healthcare workers who steadily and robustly are running the vaccination program and are continuing to do a good job in that regard. It's important to remember that one of the key weapons we have against the fight of COVID-19 is the vaccine. And in the coming weeks, we've been repeating in every briefing that we've met you, we have enough doses available, so come forward and get your vaccine. Again, to remind you, the COVID-19 restrictions, adherence measures continue to be very important. It continues to be important for you to mask. It's important for you to continue washing your hands. It's important for you to continue social distancing. Like I said, today we are very excited because this batch is a batch that has been made possible by the Kenyan government. And I'd like to ask some of the partners who've collaborated with us to come and say just a quick word, 2 minutes. I'll start with Tito from AVAT. Karibu, Tito.
Good evening, everyone. I'm here representing the United Nations Economic Commission for Africa, which is one of the strategic partners in the AVAT initiative. And the key message that we would like to send tonight is that it is possible for Africa to pool its own resources, be able to create an off-taking mechanism that supports local pharmaceutical manufacturing. As you have heard from the CAS, Dr. Mwangangi, these vaccines have actually been manufactured in South Africa. What this means, looking ahead, it is possible for Africa, once it pools its own resources, to be able to support local manufacturing of vaccines, which is not only going to save lives, save economies, but also create jobs for our continent. And this is the story of the African Continental Free Trade Area, creating one market that supports manufacturing in Africa. Thank you very much.
Thank you, Tito. I think the key resounding word today is about Africa being self-reliant when it comes to vaccines. And so let me invite Africa CDC representative, Dr. Acham, to come and say a quick word.
Thank you very much, Excellency Mwasi Mwangagi, CAS, the Republic of Kenya, and distinguished guests from the Ministry of Health, the Republic of Kenya, and distinguished colleagues from the AVAT, the Afrexim Bank, the UNICA, and all other partners who are here, and the people of Kenya. Dear colleagues, my name is Dr. Acham. I'm the Eastern Africa Regional Collaborative Center Coordinator. On behalf of the African Union Chairperson, Excellency Dr. Musa Faki Mahamat, and the Africa CDC Director, Dr. John Kengasong, I am pleased to congratulate the government of Kenya and the people of Kenya, and also all the partners who made this happen. Excellency and colleagues, African CDC is a specialized technical institution of African Union that is mandated to strengthen the capacity and capability of African public health institutions to detect and respond quickly and effectively to outbreaks. So during this pandemic, African CDC has worked along member states together hand in hand in various different pillars. Dear sirs and colleagues, one of an important tool to prevent the spread of the disease is COVID-19 vaccination. And COVID-19 vaccination had been limited on the continent due to inadequate availability of global supply and also limited vaccine manufacturing capacity in the continent. As part of a mechanism to support this effort, among others, the African member states, with their commitment and initiatives, AVAT was established by African COVID-19 acquisition task in November 2020 under the African Union chairmanship of His President Cyril Ramaphosa.